can talk more about this issue. And people can get quite afraid when reading this. It could appear when you read the headlines that young people are getting strokes left and right associated with this condition. But you're right in stating that in the background before the COVID pandemic, we have been seeing an increase in stroke among young adults. So that's the background, and that has been an ongoing issue. And the reasons, all of the reasons why this is happening is unclear. We've talked about how it seems like some young adults are getting risk factors at a younger age for stroke and heart attack, and that might be part of it as well. Right. But there has been some anecdotal evidence that some centers are seeing more strokes in young adults, and the reports are not yet very detailed. The numbers are small.
Right.
And what we have seen is that at least from the people that are admitted in the hospital, about 5% or so might have a stroke. Now, you may know that the vast majority of patients that have or get infected with COVID don't go to the hospital. So there's a large group of people that have very little symptoms or no symptoms.
Right.
And then there's a small group that requires to come to the hospital, and then there's even a smaller group that needs to be in the ICU. We know from previous research that people that are sick in the ICU with infections, whatever they may be, have an increased risk of stroke, just because the body is fighting this infection, and people are not moving, lying still in bed, and all of that predisposes to clot formation.
Got it.
So that's something that we know happens in general, irrespective of the agent. And then we also know from previous studies done with other influenza-like illnesses or epidemics that there is an increased risk of stroke with those types of infections, especially with younger adults. So that's something that we also already know from previous publications. So it's not entirely surprising that the risk of stroke would go up somewhat among the population in general, particularly young adults, while there is an influenza-like illness ongoing. So that is not surprising either. I think that we will need more studies, larger studies with multiple centers to try to grasp at what the magnitude of that increased risk is. It's most likely not very large. The vast majority of people are not going to have a stroke associated with COVID infection. We personally, at our center, at our comprehensive stroke center and at our network, is not something that we've been seeing. We have not been seeing young adults coming with strokes. We do not have, of course, the degree of infections like New York does, but we are a hotspot within Florida. But we haven't seen that. We haven't seen that same trend here.
Okay.
And it hasn't really been reported across the state either, just from anecdotal reports of querying, asking the other leads at the other stroke centers here in the state.
Okay, so
that's reassuring, but it would be expected, like I said, that the risk of stroke would increase to some degree when there are influenza-like infections, and coronavirus is likely not going to be an exception.
Right, that's very interesting. I think the articles didn't quite say that. I guess maybe they just assumed we would know that, but that's good to know. And while people are fighting infections, pathogens, or this one or other viruses in the ICU, for example, I mean, are they administered blood thinners, or unless they have underlying like high blood pressure, are they, is that part of the treatment, or they focus on the infection only, and not blood thinners?
So for many, blood thinners is a part of the treatment when they are having severe symptoms of infection associated with COVID-19. And part of that is the body's own response to the infection can produce things that make clotting happen more easily.
Right.
And that's usually for the sicker you are, the more likelihood that there is. And what's mostly at risk is the veins. So the veins, the blood flow on the veins is slower.
Right.
And for that and some other reasons, it is easier for blood in the veins to clot. So we always hear about deep vein thrombosis,
right,
or pulmonary embolism. Getting clots on the arterial side, the faster flowing blood is more difficult.
Right.
So stroke happens as well as heart attack happens when there's some blockage on the arterial side, not on the venous side.
Right.
So that's a difference that is also important to make.
And the fact that this virus particularly seems to create more of a clotting issue throughout the body may be a factor in which may produce, even though it's a small percentage, slightly more strokes than would the bad flu or something like another virus, correct? I guess.
It might be. We don't know. It's more than other viruses.
Right.
Just to quote you, for example, this is a publication from this year on the journal Infection, and this is for people that were having influenza-like illnesses, so respiratory tract infections that were influenza-like. And the risk for those for stroke under 45 years old, there was a ninefold higher probability of stroke within 15 days compared to those that didn't have an influenza-like illness.
Wow.
So is it going to be more than that? Is it going to be just about that? We don't know. So time will tell. But I think that people should be reassured that this is not something that we are seeing commonly being presented with COVID. And also, I should clarify, this risk of clotting that we're seeing, we don't think it's related to COVID. We think it's more related to the body's response to the infection rather than to the infection itself.
Okay. Understood. And then just stepping back a little bit, I know we last year we talked about this trend. I mean, not related to COVID, but generally strokes, higher rates in the age group of 35 to 55, which is not a big mystery, but I mean, I guess we can tie it to the obesity rate epidemic or more incidence of diabetes and high blood pressure among younger people. Is that still what we're seeing out there, regardless of COVID, I guess, just generally, because this is Stroke Awareness Month? So, so
the challenge is that, especially for young adults, when we look at what causes stroke, what was the reason why someone had a stroke in young adults, and after getting the standard usual tests, about 40% of those adults, we don't know what caused the stroke. So all the tests come back negative. So that's a large percentage. So it's hard for us to say for sure what is driving that increase in young adults when the unknown is so big. So definitely more research is required.
Okay.
And you can also imagine if 40% of those young adults with a stroke have no reason, there's a percentage of them that are going to test positive for COVID just because it is something that is currently prevalent in the community.
Right.
And you wouldn't know if it was because of that COVID or the body's response to the COVID that the person had this clot, or it was just those same group of unknowns that we already know exist in 40% of the time.
Right. Okay. And so that's that at least. So the other 60% have some kind of underlying health issues. Is that correct in terms
of? They have some kind of underlying etiology.
Right.
They might not have a specific health issue beforehand. So, for example, some of that can be a tear that can happen on the artery because of trauma or some other reason, and they didn't have anything before. That was just something that they got at that point in time.
Right.
So some of them will have known underlying health issues, some others will not. We think that not having an active lifestyle, tobacco use, or recreational substances, all of that may play a role into why we're seeing more stroke patients in more strokes in young patients before the COVID pandemic, more diabetes, obesity, all those things that you're mentioning, hypertension.
Right.
So all those things we think play a role. We just can't pinpoint it to one specific thing.
Right, right. And then generally, I guess, in terms of Stroke Awareness Month, not just for the younger population, but I guess for everyone, what is the message in these strange days we're living in? For people who, to be aware of stroke and the risk factors, what would be I guess, the most important message for our readers at this time, you think?
It's important to know that hospitals, especially in our area, but I would say in general, outside of maybe some hospitals in New York that are truly overloaded with patients with COVID, that the hospitals have the resources and staff and space to care for patients that have a stroke. The resources that are used for COVID are somewhat different than the ones that are used for stroke patients. And if there is a concern that someone is having a stroke, they really should go to the hospital to get evaluated as fast as possible, because we have treatments that can really change the outlook for someone with a stroke and prevent long-term disability, but it is time-dependent. And also, there's a risk of having a second stroke shortly after having the first one. Of course, if you have a second stroke, you have more disability, and the risk of death also goes up. So coming to the hospital allows to test for those things that have a higher risk factor, have a higher risk of getting another stroke, so we can minimize that as much as possible. The hospitals have specific protocols in place designed to minimize cross-infection, so that if you come in with a risk of a small stroke or a TIA, what we call transient ischemic attacks, the risk of that person catching an infection in a hospital is minimized.
Right.
So you shouldn't be afraid to come to the hospital if there's a concern that it's one of these emergencies. The risk of having permanent disability or death from a stroke is much higher than from a COVID infection as well.
Right, right. And we'll remind people of all the signs and the FAST and.
FAST is the way to go for sure.
And of course, if you have underlying health issues and you take medications for high blood pressure, it's important you keep taking those. And
right, you don't want to stop taking your medications because of fear of COVID.
Right. I don't know if Peter's on yet. Is Peter?
I am.
Hey, Peter, how you doing?
I am.
Doctor, I think.
How are you, John?
Good. Thank Peter. Doctor, I'm good with my topic here. I'm going to turn. Thanks again, and another, very revealing and interview. As always, I always learn something. I'll turn it over to Peter.
Happy that it was of value.
Oh, absolutely, always. I will turn it. I'm going to be doing something separate on COVID and stroke and young people for Stroke Awareness Month. In the next few days, I'll send you the copy, and then Peter's doing separate. You'll explain in a minute separate story, and then we'll get back. We'll be in touch on a regular basis, probably throughout the month. Thank you again, Doctor. I'll turn it over to Peter now.
All right. Doctor, how are you?
Good. How are you, Peter?
Good, thank you. We spoke last Friday afternoon. This is going to be a standing date, huh?
Happy to help.
Good. Well, I don't think I need too much of your time, because last week we spoke about the decrease in stroke cases presenting to the ER, and I've got plenty of good information from you on that. What we're going to do, Danielle and I decided after the three of us spoke last Friday, was that we would write a kind of a general story to kick off Stroke Awareness Month. That would publish early next week sometime, as soon as we can get it written and approved. And that story would